completely ruined. Yeah, we're here, guys. We're here.
We made it.
Okay, I have no idea if anybody's actually watching, but hey, you know, we can have a chat. Oh, we are live. Fish has just seen it, so yeah. Oh yeah, we look great on the screen. We look great. I've seen it. How are you?
Yeah, I'm good. How are you?
I'm good, thank you. I'm good. I had a great day yesterday, so I'm very happy bird, very happy. I've changed horse today for the background.
Oh, nice. Yeah, mix it up a bit.
Yeah, I thought mix it up a little bit. I was having a bit too much of Sid having a wee and a poo every single time, so I was hoping that maybe Bambaroo wouldn't like give me as much grief. So, guys, thank you so much, and sorry for bearing with the tech. Hi, Jane. Can you see the comments?
No, I can't.
Okay, so I will obviously tell you if there's any comments that are coming through. Nice, of course. But thanks so much for agreeing to come on, bless you, because I've like harassed you to come on.
No worries, it's fine.
No,
you'll have to excuse the beach look that I've got going on. We've not long got out the sea, so.
Oh, nice. So you're away at the moment, are you?
Yeah, we're just down in Devon, just near where I grew up. So just down with my partner's family. So having a great time.
So how on earth have you managed to get in the sea?
Well, I've been using the crutches down to the sea. Yeah. I leave them by the lifeguard flag, and then I sort of hobble along with the two lads either side, ready to catch me. They give me some funny looks. So like, if anyone's going to need rescuing today, it's going to be that one.
Oh, bless you. So obviously I know that you've had quite a nasty riding accident recently, but just to get the guys up to speed. So we obviously met in A&E when you were working as a sister in A&E. And I was working there as well. But how long have you been nursing for then? Is it years and years or?
I've been nursing for 7 years now.
Okay.
So no, not really a huge amount of time in the grand scheme of things.
always in A&E, Jen, or have you done like wards and stuff as well?
I did a year of neonatal when I first qualified and first moved.
That's scary.
Yeah, it's quite scary. They're quite small.
Yeah. Handy for A&E though. That's why you're always so calm with a paediatric patient, isn't it?
Well, yeah, I like to think so. So I am paediatrics by qualification, I suppose.
Are you?
Yeah.
No way. You see, look, I'm learning loads already. That's ridiculous. Okay, cool. So you ended up in A&E and then you've just moved, haven't you? What are you doing now? Well, obviously once you're full-time back at work and stuff, what's the plan?
So I'll be working for the university, and I'm a clinical skills teacher.
Cool.
Yeah, so student nurses, so they'll have their lectures and then they come to the lab and I run the lab and teach them how to do everything practically.
Amazing.
Yeah.
So that's cool. So, but we met mainly, didn't we? Because we were the horse bores in the department. Because it's one of those things, isn't it? As soon as you find someone that likes horses again, you just like, and everyone's like, oh, they're horse boring.
Oh, great.
Boring. So, when did you start riding and stuff? From a kid or?
Yeah, really small. I remember my sister going riding when I was really tiny, and I was too small, really. And being really jealous that she got to go. And then my mum, I think my mum let me have a few lessons when I was small, and then probably wish she hadn't after that.
So did you have a horse when you were growing up then?
I never owned my own when I was growing up, but I used to look after other people's, and I had one that was sort of on loan, but she was actually my neighbour's horse, so she was lovely.
Oh, bless you. But you have recently bought a horse, haven't you?
I have. My big boy, he is Bailey. He was sold to me as 15.3 and has since shot up, or the passport wasn't quite right. I'm not sure, but he's now 16.2.
I was going to say, he's not 15 ounces, he's massive.
He's huge, yeah. And he was really, really skinny when we first bought him. Yeah. He was in a field with two other horses that basically used to eat the hay that was given to them, and he's not really pushy at all. Okay. So I thought. until now. When he's gone upwards, he's gone outwards, and now he's like, I'm the boss.
Check me out now. I'm full of it now.
Yeah.
So,
He's
is
lovely.
he the first one that you've owned then? Is he your first horse?
Yeah, my first official owning horse. Yeah.
How old
And I
is he?
love it. He's 6.
Is he? Oh, bless him.
Yeah.
So he's got a bit of growing in him yet as well.
Yeah.
How tall are you? Because you're not tall. You're not tall.
No, I'm 5'6".
Okay, yeah. Because I'm like giant, aren't I? But like, you're definitely not as tall as me.
Yeah.
So, what did you get him for, Jen? What's your plan for him? What are you going to do, or what were you planning to do?
I mostly just really enjoy owning them, having them around, and having to tend to them and things, and hacking. What was supposed to be the plan for next year, which might not make it next year since this injury. Hoping to do a one-day event or something on him, and then see where we go. But he's teaching me some stuff. So even though he's really young and he's not very confident, and he needs me to be confident to push him into things, he's sort of teaching me some things. He's got some nice strides and things, and I can feel that he's got some potential there, probably much more potential than I will ever have. But
no, because you'll go with him. You'll go with him.
Yeah, we'll see what we do.
Just the thing is, like I've said before, you know, they don't care about their potential. We always give ourselves a really hard time, don't we? And say, oh, this horse is wasted on me. I do this with this one all the time. She's so good. She would be amazing with somebody else. But they just want to eat the grass, like, and chill out and have the nuggets of treats, don't they? So I wouldn't have a hard time. So
Love
go on
treat.
now. What everyone is dying to hear. I heard about it because I heard you'd come into trauma call. Naughty girl.
Not the first time.
Happened. I know, but tell me what happened.
So we were just out hacking. So since my new job, I've been so lucky. The weather was beautiful. I managed to get out on him pretty much every evening. So I'd shut the laptop at 5 o'clock and I was straight in the car. And this one Friday evening, I was going to go for a hack. And I don't know, I got this weird feeling before I went. And I thought, oh, God, I just don't feel right, like something's wrong here. And there was nothing wrong with him, there was nothing wrong with me, the weather was fine. And then my partner rocked up on his bike and I was like, cool, everything's sorted, we're going to be fine now. So we went for a lovely little hack, went for a canter up a potato field. We were just on the way home and I was saying goodbye to Tom. He was going to go and see his dad, and a man just popped out of the hedge, which I don't know why. It was his garden, but he was sort of the other side of it. But I didn't see it happen. I didn't know this had happened until a few hours later. I turned around to sort of say, bye, have a nice time. And this happened and Bailey just took off. And just, managed to grab the reins back because I either lost them or wasn't holding on. I'm not sure what's happened. Grabbed them back. And because I did, he sort of went, oh my God, I've got to stop, put his head back, which slackened off. And I just came off in a riding position, just onto the road. And I knew from the second I hit the floor, like I've hurt myself from riding accidents before, but I knew there was something more. And I just screamed so loud.
Did you?
Oh God, Tom! And I was on the floor just in the fetal position. Managed to save my head. I think the hips and the elbows took the majority of the impact, and I sort of kept my head up and just, oh my God, I just started shaking. I was like, oh my God, something's happened. It's really bad this time.
Oh no. And what was it that made you think it was bad? Was it just that feeling of this is real pain? Was it pain or fear or what? What was it?
It was pain. Like, in a way, when it happened, things slowed down. Like, there was a point where I thought, I'm coming off here and there's nothing I can do about it and it's going to hurt. But there was the pain in my left side, but it was the feeling down my legs that I just thought, oh my God, this is not good. So then I was just lying on the floor, it's sort of still in the fetal position, and people had obviously heard me scream, had come out from the village and were having a look to see what was going on. Tom was there and he was like trying to make me comfortable, and he was like, do you want me to phone an ambulance? I was like, give it a minute, because if it is just shock, I'll get up. And I went to try and move, my elbow was stuck underneath me. I went to move my arm and I was like, oh my God, no, I can't get up on my own. This has got to be a proper job here. So they called the ambulance, and I knew the crew when they arrived, and I was just so partly embarrassed, but also I was just so grateful to see some familiar faces.
Yeah,
and I think I might have sworn.
They scooped you, did they? That's all right. You were allowed to swear with the injuries you had. So they scooped you up then and brought you in?
Yeah, they did. They did a good job.
So what did you manage to get? Did you manage to get some neck blocks? Did you get a scoop? Did you get the vac mat? What did you get?
I got a scoop, actually. Yeah.
How was that?
Yeah, it was quite an experience. Bit of Ventanox, which I hate. I've only had it once before, and I'm not a fan. But at that point, I was like, you could do anything. They said they needed to take my clothes off. I was like, cut them off here. I don't care, so long as it doesn't cause any more pain or damage. Then do what you need to. So I didn't have any C-spine tenderness, didn't have any neck brace, just had the blocks beside me. And then they cannulated me and got me into hospital.
And you came to your own hospital, didn't you?
I did, which was a relief in a way. Again,
insult to injury. Hi!
Exactly. I'm back. I'd gone for all of about 3 weeks, I think, before I was back as a patient.
Yeah, because it's not that long ago that you had this, is it? What is it, 8 or 9 weeks, is it? How long are you on now?
Yeah. I think it's 10 weeks this Friday. 10 weeks tomorrow. So, it's not that long, really.
A little bit. Oh, you're back. I'm not sure. You may have carried on, but how long is it? About 8? Is it about 9 weeks, is it? Or
I think it's 10 weeks tomorrow.
10. Yeah, so it's not very long, really. So go on then. What was it like coming into the team? Whole different perspective. Scarier? Or...
I think scarier in a way, because I felt like I should know what's wrong and I should be brave and things, and I was not brave. I cried for about 2 hours, I think, because I couldn't feel my legs and I was frightened.
I'm not surprised.
But then in a way, seeing some familiar faces, I just thought, actually, this is good. This is my bag, my people. You kind of end up assessing yourself, don't you?
Yeah.
You're part. It's a really weird situation to be in when you're neither patient nor staff. You're sort of a bit of both.
Because it's awkward for us, isn't it, when we look after each other in a way as well, because you almost you don't want anything to go wrong with anyone anyway, do you? But when it's somebody it's like you almost feel like every single line you're going to try and put in would be the one that would never go in, and it's just it can put a lot of pressure on the staff as well, though, can't it? Because they're worried. And obviously you did have, we'll go into it in a minute, but you have got proper injuries. So for them, I can imagine that if I'd have been working and you were telling me you couldn't feel your legs, I'd have just felt sick. I'd have felt absolutely sick as a dog, worrying about you in a different way to other patients, because I'd be worried, but I wouldn't know them. And then I would, so it's difficult, isn't it, to keep your kind of head. So they did, fair play to them. So go on now, tell us, what did you do? I know, but they don't.
So I actually couldn't remember what I'd done until I got the discharge summary when I left hospital.
Way.
I knew a few bits of it, but I couldn't actually remember specifically what I'd done. So I managed to fracture 6 vertebrae and the left side of my pelvis.
Bloody hell. That's not, one vertebra is a significant injury, but 6. And pelvis, not good. And was there an effect now because of COVID, do you think? Because I know that we got the alerts about the trauma, didn't we, with COVID at the time, about what we would, and I know that people maybe that are watching have maybe broken stuff or whatever. It's been the management of stuff's had to be slightly different, hasn't it? In that people have waited longer to be seen, obviously not while you're in hospital, while you need it, but afterwards and stuff. Do you think there was an effect with the, did you go to like red or green resus? Where did they put you? Green.
I went to green resus, yeah.
Okay.
The crew had taken my temperature, and they said, oh, it's 37.8, it's sort of borderline. And I was like, look, I'm well, I've been fine, I've been isolating, you know, we followed all the rules. I was like, please don't put me in red resus.
Oh, bless you. Bless you.
Not that it mattered, because they ended up getting COVID anyway, but not until a bit later. So that wasn't anything to do with the hospital. It was just one of those things.
One of those things. Bless you. So go on. So how long were you in hospital for then?
Only 4 days, which wasn't too long, I didn't think. I was desperate to get home. I mean, it was hair wash night the night it happened. So 4 days later, I was like, I feel disgusting and everyone knows who I am. So now I look even worse.
Oh, bless you.
No, it took a bit of time just to get the right analgesia on board, because I think I'm just a bit of a lightweight. I always have been with alcohol, with medication, anything like that, and it just made me so sick for about 48 hours. I couldn't keep anything down. And
really?
yeah, so the pain nurse came to see me, who was a very lovely lady.
Right.
I don't remember her name. I just remember her coming in and saying, we'll get you off that. And then the next time I felt so much better. I was like, oh, good. She's a winner.
Oh, yeah, definitely. So you've got, I'm just going to go through because we've got a load of comments. I'm just making sure that I don't cut you off. So there's a lot of oh my gods and goodnesses and ouches and wowzers. Emma Berry, you know Emma Berry from Vic's Lives, who is going to hopefully come and clip my horses or show me how to. But she said that she was mortified when they cut your breeches off. I'm sure we did a collection for some item of clothing for you. What did we cut off you?
So my nice Jules hoodie, which I was quite attached to, my fault for wearing it riding, and my favourite jodhpurs, unfortunately. But I did have a collection done, which was so kind of everybody, and I will be replacing them as soon as I can.
You. And they got your boots off all right then. What did you have on? Joddy boots or?
I had long boots, but they've got a zip at the back and they're quite easy to get on and off. So
they got those off again. So I'm just going to zoom through the rest of these so that we don't miss them. Oh, Betty says hi. Great to see your smiley face. Betty, we love you. Jane saying, did you have surgery? You didn't. You don't need any surgery, do you?
No. The orthopedic consultant had a look at the scan with the radiology consultant, and they decided between them that we could probably get away with conservative management, which was my favourite option.
Yeah, because that would have been like big scary stuff, wouldn't it? Really, like pelvis. Was it pelvis they were thinking about, or vertebrae? Pelvis.
It was the pelvis, yeah, because it was semi-displaced, so they were a bit like, what's the best option?
Yeah. But so just for the guys that are watching, like we're really careful, aren't we, when patients come in with trauma about pelvises, because there's lots and lots of blood vessels and particularly veins that sit around sort of inside of the pelvis, isn't there, Ginny? And yeah, because Ginny's just saying that hers was displaced, so the pelvis kind of sits like this, but hers will have just moved slightly like that, and it just puts a bit of pressure on those veins, and if they bleed, you know, that can be like a massive problem. So we have to be, you know, super careful. Tom's put, that's my girl, so brave.
I was not brave.
I can't really do a heart, Tom, because I'm a bit like distracted, but that's a heart. But yeah, so the rehab, because I know we spoke, didn't we? Because obviously I was worried about you anyway, and I'd have phoned you anyway, but we spoke. Because what do you think was the hardest thing when you got home?
I was really naive about injury, I think, because in A&E we patch people up and then we're like, yeah, you're good to go home, off you go. And I was desperate to get home, and I got there and I thought, oh my God, the toilet's really low and the stairs are really high, and just things that I hadn't even thought about. And then just emotionally, Oh my God, I was an emotional wreck. Just on a roller coaster. I'd take some pain relief. I felt it was all manageable. And like, yeah, it's one of those things, it'll get better. Sort of half an hour later, I'd be in tears and Tom's going, why? What's going on? I don't know. And I just thought that I sort of thought I'd broken my arms before. You know, you break your bone, you carry on. But it was a very different injury to anything I've ever experienced. And I've never really done rehabs. So I've not really had that sort of feedback from other patients before as well. And it's harder.
Yeah, well, definitely. And if you think about it, because you broke some thoracic vertebrae as well, didn't you? It wasn't just lumbar. So what Ginny did was in her back, the kind of the vertebrae, you've got the ones in your neck here that end with the really spiky bit, and then you've got the ones in the thoracic part of that hold the rib cage together at the back. So every single time you will have breathed, you will have pulled on that fracture. So funnily enough, you'll have been you must have been in agony, absolute agony.
I was, yeah, but I wasn't very good at taking the pain relief initially, because it says quite clearly on the bottle that you could potentially become addicted because it's a very strong opiate. And my nurse brain just wasn't working. My patient brain was just like, oh no, I'll become addicted and then that'll be awful. And how will I ever be a normal person again? So let's just not take it.
Yeah. No, but then we talked about that, didn't we?
We did, yeah. I had some advice from some knowledgeable people.
Yeah, we talked about that, and that's important, I think, because like you are trying to get better, and I think questions as well. Like we're pretty hardcore. Like we're not a sort of pill popping kind of type of person, are we? So it's like, oh, you know, carry on. And if you think about how many people we see that, you know, have carried on mucking out with a broken this and a broken that, and then you see them, like, they're always delayed presentations almost, aren't they? Unless it's an absolute acute, you cannot physically get up, they probably will have taken the horse back, sponged it off, put a rug on it, and then collapsed in a heap and gone, yeah, actually I do need to go to hospital. Bless you. So but you've been up to the orthopedic hospital now, haven't you? And you've got a rehab plan and physio, because that was delayed a bit, wasn't it, with COVID?
It was delayed. It wasn't their fault. They'd booked me in for 6 weeks, but I hadn't actually been clear of COVID myself. It'd only been 10 days and they need it to be 2 weeks before you come into the hospital again.
When did you, I'm not saying where did you pick it up, because you could have picked it up anywhere, couldn't you? But when did you, like, after the injury, how long afterwards did you get blinking COVID?
Must have been about 4 weeks.
Really?
3.5, 4 weeks later, yeah. And it knocked me. Like, I don't normally get anything. I get the odd common cold and that's about it. The amount of stuff that goes through the departments, and I've never caught anything off a patient and things. And it really knocked me. And I don't know if that's just because the virus was really horrible, or if it's because I was so vulnerable at the same time as the virus being quite nasty.
I think you're right. You know, I think with trauma, you know, or even just post-op or anything that sort of sets off adrenaline and cortisol and everything else, like, it does give your immune system a hit, because that's why, like, we all run on adrenaline and stress hormones, don't we? And then we get a week off and we're always ill, because you just like, actually you stop and then your immune system takes a dip. So I think the trauma will have, like, definitely suppressed your immune system. Sarah's saying, do you think it's worse having an injury, both being medically trained? What do you think?
Yeah, I think it is.
Yeah,
ignorance is bliss.
Yeah, no, it definitely is, because you know all the things that potentially, and then I think I found that people, you know, and I suppose it is a bit of a criticism, but people didn't explain things very well, because it's like you said, your nursing knowledge just went out the window. You are absolutely blank in the brain, aren't you? And people are just like, oh yeah, you get it. And it's like, no, I really don't. Like, I don't get it, because I can't put it into context of it being me.
Yeah.
Do you know what I mean? And then somebody says something to you and goes, well, it's that, isn't it? And you're like, oh yeah. Yeah, you know, and you just look a bit of an idiot. But I think it is. I think for me it was harder. Would you say for you it was as well? Or
Yeah, I think it was. I mean, the fractures themselves was fine. It was the paresthesia that I was like, oh my God. So sorry. So the numbness in my legs, I was thinking, is this going to be forever? And for a few hours at least, I was thinking, am I going to walk again?
Yeah, no, well, terrifying, absolutely terrifying,
Yeah,
because,
it's quite
and that's
scary.
the other thing. Whereas, like for you, obviously in your career, you will have seen people where actually they don't walk again. So for you,
Yeah.
that's a different reality and a more real fear, I think, maybe for
Yeah.
some than somebody else. Bless you. So riding, what's the plan? Are you getting back on? Are you not getting back on? I know we've talked about this as well, because you can't do this too quickly, but how are you feeling about riding again? And
I feel a lot more positive now. About 3 weeks ago, 4 weeks ago, I didn't want to ride again. I was too scared. I didn't even want to see my horse because I was scared of being near him. I was scared that he was going to pick up on my fear and that he was going to not like me anymore, and all sorts of silly emotions that you just can't help. It's not one of those things that 6 weeks later you're fine. Like if it was my wrist, I'd get back on straight away, sort of thing. But I've been really lucky. My partner's mum and sister have been taking him out for me, so they're keeping him a little bit exercised, and the plan at the moment is to get on probably around the end of September, October time.
yeah,
Potentially, depending on how he's getting on, send him for a bit of schooling first with a view to getting on, which is what we discussed, and that was a plan that I was really happy with. And then see where we go from there, really.
I think it's important that you don't put a lot of pressure on yourself as well, though. I mean, particularly with the injuries that you've had. I mean, they're not little injuries. This is proper trauma, isn't it? And you know, and I guess even if you haven't had an injury, I think sometimes, like when we spoke, I think sometimes you just need to be able to talk through it and have a plan, but you've got to be able to be flexible in that plan, because you know you might go along. But I found definitely with my rehab that I kind of like got a bit better, and then I felt I dropped again, and then I'd get a bit better again, but then I'd go up a little bit more than what I was before, and then that would hurt. So then I'd end up, I could do that rehab, but it really hurts. So I ended up on more painkillers, I think, throughout the rehab than before, and then you get all the kind of associated problems with that. So, but you've got a plan, so that's good.
Yeah, we've got a plan. Yeah, at one of my lowest stages, I was thinking, do we just sell him? And I was thankfully talked out of it by Tom and his family. They were like, no, now's not a good time to make those decisions. We'll cross that bridge if and when we come to it. So for now, he's just happy in the field. And actually, I've been gaining a lot more confidence. I'm steadier on my feet than I was.
Yeah.
And I've just been going up to the fields and giving them treats and not trying to do anything too strenuous or too stressful. And I think that's worked. It's desensitized me a little bit, because rather than it being like a couple of days, because they've again, Tom's family have been looking after him for me, it means that the fear doesn't build up too much in my head. So then if I'm doing it every day, then it's only like 24 hours since I was last there, or 12 hours or something. So it's not too big.
No, but it's a big deal, isn't it? It is a big deal to get back on. You know, it's not, it's kind of like, and you know, don't you? Because again, we give ourselves a hard time, but you're kind of like, especially because he's quite young as well. So you'll be like, well, I don't want to be nervous on him, but obviously you are going to be feeling, you know, and you transmit so much through to the horse, don't you, when you ride them, like they know. And it's, you know, it's not an easy thing, but I mean, I know you, I have no doubts that you'll conquer this and you'll crack on and you'll be doing your 1-day event next year. But it's about having that plan, isn't it? And just getting on with it and just being sensible about the rehab. And I think the biggest thing I would say for questions, I don't know if you agree medically, is the fact that we put this pressure on about got to get back on. It's like that fall off, get on. And, you know, I think if you do just like literally slip off, have a bump and whatever, it is really important you get straight back on. But when there's been proper injuries and stuff, you actually can't just get back on. And like you said, you know, mentally that can have a bit of a toll.
Yeah, I think it definitely has. And every time, like every week that's passed, you're thinking, oh, that's another week that I haven't been back on yet. And it was quite good after I spoke to you and I spoke to the orthopedic consultant, and you both said, look, now is not the time. Yeah. It felt like it took the pressure off a little bit, because I felt like, okay, so 2 professionals have told me that now's not a good time, so that's okay. I don't have to feel guilty anymore that I'm being slow to recover or slow to get back on or something.
Yeah, I don't think you're being slow at all. Like you're not. You're not running, are you? But like you're going through really well with, like, because you're like almost back at work and stuff as well, aren't you? You've been doing a bit at the uni and stuff. So I mean, a lot of people wouldn't have been able to go back to work, and you've done amazing. Don't give yourself a hard time at all. No way. So what would your tip be as a senior nurse and a rider? What would be, this is your platform now, what have you got to say to people about riding and accidents? And is there anything that you think, well, I wish I'd done that, or why didn't I think of this? Or do you know what I mean? Because you've experienced it now. Like we lecture at work, don't we? But you've actually done it properly now.
Yeah.
Well done. Yeah. Well done.
Oh, thanks. My main thing would be use the safety equipment that you've got available to you. So I have my hat on. I have my body protector, which is hung up in the cupboard and wasn't on my body. Do not tell my mother that, because she definitely thinks it was.
You might watch this, Ginny Joy.
I know, confession time.
That happened to me when I did that interview with Vic Bodie, and my mum didn't know I was pissed when I did my injury. She does now. So you have to ban her from the internet. You have to ban her.
Yeah.
So go on. So use your safety equipment. So do you think it would have been different if you'd had your body protector on?
Yeah, I think the lumbar injuries in the pelvis, I think, still would have happened because the position I was in as I fell. But I think I would have saved myself the T4. So, 5's better than 6. So that's one good thing. And I think the other thing is just be honest with them. Like, tell them exactly what's happened. Tell them if you weren't in the right position, because if you were rotated or something, that could make a big difference to the trauma that you've sustained. And when they ask your pain score, say what it is, and don't just think, oh my God, it's a 6, but that's really wimpy, so I'm going to say it's a 3, but I'm crying.
Yeah. Because nurses don't withhold pain relief in A&E. Let's just be clear about that. When people are in pain, you give them pain relief, don't you?
Yeah, they were fantastic. I was still umming and ahhing over whether I wanted morphine or not, and they were like, yeah, you need it, it's ready, it's here, make your decision. So I was like, oh, okay, yes, please.
Yes. Take it, for goodness sake, take it.
It hurts.
Oh, bless you.
But I also think, don't not do it. Don't be frightened of what could happen. I know that seems a bit silly coming from me, who is now scared of getting back on because of that reason. But I couldn't have asked for the trauma team to be any better. Like, I knew that I didn't need the anaesthetist and I didn't need the surgeons. I needed the orthopedics, but they were all there and they all did their bit. And it's actually, there's a reason that they're asking you to do something. If it is keep your collar on or lie in the straightest position that you can. I couldn't actually lie completely flat because I couldn't have the pressure on the left side of the pelvis, and it was making it difficult. So when they were trying to assess me, I was trying to get into the best position that they were asking for, that was as much as possible, really.
Yeah.
So,
and for your scan, I guess you weren't flat for your scan then either, were you?
No, so I think that's why it was a bit unclear and why they had to have a bit of a chat about it between the bosses, what to do.
And is there anything you'd change from like a nursing point of view, having actually been a trauma patient? Is there anything that you would say to us, like, actually, I felt like this. So my one is, I always tell people, because one of my operations I had under spinal, and I could feel the vibrations of the drill in my spine, and it was the most terrifying thing I've ever experienced in my life. So every anaesthetist I meet, they get the story. Honestly, they avoid me, but they get the story. But like, if say for your colleagues, is there anything, and me, is there anything that you would say, God, don't do that? Because that was, I'm not saying you're criticizing them, but is there anything that you would change in your practice, do you think?
I think I would just explain a bit more.
Yeah.
I knew who everyone was and I knew what their roles were. And even though you sort of double look at people like, oh, you've got a mask on. Like, I recognise those eyes.
Yeah, of course. Yeah.
But even though, like, I understand medical jargon, there were times where I thought I couldn't remember what they said 5 minutes ago.
Yeah.
And I was just so focused on it. I couldn't even remember the word for pelvis. I kept saying to them, it's my hip. And I knew it wasn't my hip because I was pointing to my pelvis.
Yeah.
But I couldn't think of the word.
No. But to be fair, you probably had a rook of morphine as well.
Yeah, probably by that point.
Oh, bless you. Unbelievable.
Yeah, so I don't know. I think whenever I used to see horse riders, I always wanted to know about their horses and what they did, and what sort of exciting frillies have they won and things. And I think, equestrians always want to talk about their horses, but actually, as a nurse myself, I would probably now give them that bit more time on them before if they bring up their horses, then fine, far away, but rather than like, oh, how big is he? That sort of thing.
See, I am so guilty of that. I would never have even thought about that. And I think it's me trying to show like empathy, that I understand, and I'm not like looking at them badly because they've been riding. I'll be like, oh, that's amazing what you do.
Yeah.
And actually, I wouldn't have even thought about that. So that's quite useful. I'll stop asking people. In fact, I think I did do that at the weekend. So if those people are watching, I'm very sorry. But I was like, oh, what do you do? How big's your horse?
Yeah.
Oh, is it? Yes, I do have them. Yes, I do. Yeah, I am. Yeah, I hadn't thought about that. Oh, bless you. So nearly there then. So we will catch up with you anyway. But I guess, is it just physio and, I say just, but physio and plod along? Yeah.
Yeah, that's pretty much it, really. The physios have been great because that's all different because of COVID as well. So they saw me the day I went to see the consultant. They actually did some physical assessment with me, which was really good. And she came up with some exercises. And I've since had a telephone follow-up, which next week will be a video follow-up. So she can actually see how I'm moving and why I'm limping and things.
So that'll be good. See, that'll be, yeah, because it's the impact of COVID has been huge, hasn't it, on our practice? And there's been a lot of stuff that's gone to telephone.
Yeah.
I mean, obviously, sort of for trauma and stuff, that's not obviously happened for us, but the follow-up for a lot of people will have completely changed to like telemedicine type stuff, won't it? Do you think it's the same? Like, do you feel like you're still getting what you need, even though it's over the phone?
I do. I just wish that they could see me, because my limp is quite funny. Well, to most people. So I think if they could actually, like, I had to try and explain a lot, and she was really good. She spent a long time on the phone with me trying to make sense of what I was saying. But even with my sort of medical understanding, I couldn't put into words exactly what I was feeling and why I couldn't quite extend my leg properly.
Yeah.
So I think it has.
Okay, so I wonder whether that could be the pelvis, couldn't it? Could just be the pelvis, I guess.
Yeah, she said, I had to explain something, and I said, look, I know this is not going to happen. I know it's not a thing, and it couldn't possibly happen, but it feels like my hip's going to pop out every time I take a step right forwards. And she said, oh yeah, that's just that's a positive Trendelenburg. And I was like, oh good. That sounds great. What does that mean?
Is that going to go away then? Please.
Yeah. Is that a long-term thing, or will I get over that? But
I think
yeah, it's great.
what I found really surprising is the amount of, and I think that's for all fractures, how quickly you waste muscle. I did not expect. I ended up with like a chicken leg of a leg, like literally within like 2 weeks, the muscles were just hanging off my legs, and you just don't realize how quickly you decondition.
No.
You know, and I think a lot of that, you know, your instability as well, and there will be probably a degree of ligament stretch as well, potentially, won't there? But you know, as you rehab through and strengthen all those muscles up around it, you hopefully will start to feel a lot stronger with it. But
yeah, I feel
it's not
stronger
easy.
already, so that's good.
You look good. You look great. So
Put some makeup on.
Yeah, good girl. So did I. I was like, oh, I did take Win for a quick spin. I was like, oh, I've got 20 minutes. I can get that through. Right. I'm just going to go through these comments because you've got loads, Jen. So let me just go back. I'm hoping that that's quite funny. Riders pain score via normal pain score, calling a 10 or 4, lol. That's very true. Andrea says, good luck with your recovery. Emma Berry, I love that warm, fuzzy feeling morphine gives you. Well, don't be throwing yourself off the horse just so you can have it. The staff, Jane Brinney said, staff kept telling me to self-administer, to use the self-administer thing, but I wouldn't. I bet that was a PCA.
Yeah, it sounds like
PCA,
it.
Yeah, people get scared of pressing the button. Tamara says she totally gets it. She had a burst fragmented T9. Ouch. When you get back on, this is useful, Ginny. And when you get back on, I was really helped by being led for a week, then on a lunge, just in walk, then a bit of trotting on a lunge, and then just stay on the lunge circle, but off the lunge. And it really helped her.
Oh, brilliant.
I mean, whether Bailey would want to do that or not, but you may well go on a quieter horse just for the first time back on anyway, mightn't you?
Yeah.
Polly, haven't you? Is it Polly, the other one that?
Yeah, Polly Pocket. Yeah.
Sarah says people put so much pressure on me to get back on again after my fall, and it made me even more scared. See, I agree with that. That's a nightmare, isn't it? People just give that pressure all the time. When are you getting on? When are you getting on? When are you getting on? And then you start going, when am I getting on?
Yeah.
Vic says small steps. Small steps, absolutely. Well, she does take small steps now, I'll be honest with Buster. Jane says take it at your own pace. Amy from work says we miss you and we love you, Ginny Joy Reeve.
It's mutual.
Yeah. Sarah says you're doing amazing to be doing small bits at work already. Jane says it's definitely a mental toll. I decided that if I got back on, I'd treat myself like a beginner rather than thinking I'd get back to my previous skill level. I think that's a really good point, isn't it? That you think, I should be doing this, or I should be jumping this, or I should be doing this, and you're not necessarily in the position to do it. Another Jane says, hold on. There are really useful trauma therapy techniques which can help you separate the emotions from the memory, allowing you to learn from the incident but move on without the overwhelming fear.
Oh, that's
Wish
brilliant.
I'd known about that because I was blinking, but I was scared of walls, so it's not quite the same. Emma says her leg looked horrendous after 10 days, no muscle at all. Have you got muscle wasting then? Have you got it, or have you been spared that joy?
I didn't think it was that noticeable. I thought it was just because I know what I look like. But the orthopedic consultant said it. He said, "Oh, you've probably got some," and then he went, "Oh, wow, that's quite a lot." And I was like, "Oh, good,
yeah. Oh, thanks very much. Thank you." Jane says, "I had one very hairy but emaciated." It said, "Rehab is essential. It's what helped me keep going." Caitlin says, great advice, Ari, using the safety kit you have available. Cue to dust off her air jacket. Yes, you absolutely must dust off your air jacket. But I'm the same. Like if I go for a hack, I will put on, the race safe. But I've got an air jacket, I mean, why? It's just stupid, isn't it? It is stupid. So, yeah, we should think about that. So we've only got time just to squeeze a couple of the medical questions in, but that's fine because you can help me answer them anyway. So Donna from Cornwall, she's got a fractured clavicle, Ginny. She's having trouble with ongoing pain. What do you reckon?
Take your pain relief.
Take your pain relief. Yeah, we are really like just. My husband will be rolling his eyes because every time he says there's something wrong with him, I'm like, take some pain relief. Have you taken pain relief? It's our first question, isn't it?
Yeah.
When they rock up
What
and say, this hurts.
Yeah,
Taking any
exactly.
paracetamol?
What have you taken? The good thing is with analgesia as well is because different analgesias last for a different length of time, you can actually cross over to a point where you're not ever not covered by something. So like you've got your ibuprofen for 6 hours if you're able to take that. If you then take your paracetamol, say after 4 hours, then that's going on for another 4 hours after 2 hours after the ibuprofen's worn out. So you can sort of balance it a bit more easily.
Yeah, definitely. And they work really well together, don't they? Because different painkillers do different things. And sometimes people don't realise that you can actually take them alongside each other. I'll maybe pop a post on the page then about what you can take. You know, because...
Another thing with clavicle might be just doing, if I don't know what stage of recovery you're at yet, but as soon as the bones are healed, just doing some muscle exercises and try and free everything up, because you probably haven't used it very much for about 6 weeks, I would imagine.
Yeah, because they put them into the slings anyway, don't they? And I honestly would say, like, a fractured clavicle is really bloody painful. Like, it really hurts.
Yeah. I've never had one, thankfully.
You haven't? I haven't had one, but I've seen people with them. And when you look at the X-rays and they're like tenting the skin and stuff, it's like, yeah, that hurts. That really hurts. And again, it's one of those ones where it's part of the rib cage. So every single time they breathe, I'm being used as a scratching post. But thank you, Bamba. But every time they breathe, they're actually literally just grating bones. And we don't operate on that many, do we? It's very small percentage that are, plated. So, yeah. What else have we got? Oh, this is well, I'm all right with this, but I don't know. Obviously, other people aren't. Megan, really struggling because she keeps getting urine infections all the time. Is there anything she can do to prevent them? Now, but my sort of thoughts on that is, unless she's got something that's, making her more likely to have some, so a structural problem, I guess you could be more likely to have them if you're sat in a saddle all the time. I wonder whether it is actually a UTI or whether it's just cystitis from a bit of bruising from a saddle. I don't know. What do you think? That would be my...
It could be that it's just more likely to be cystitis, really, isn't it? Because the position and my other advice would be make sure you're wearing natural fibres. Yeah. So your breeches
no lacy G-string for riding.
No lacy knickers. And drink plenty. Always drink plenty so you can flush it all out.
Exactly. No, I would agree with that. But I guess if she's getting them all the time, the only thing I would say sort of with the medic hat on is that unless it is most likely, unless it is cystitis, I'd probably want to know why, because she's only in her early 20s. I'd want to know why she's getting so many, because sometimes people can be like diabetic and stuff, can't they? And it's actually that their immune system isn't great. So yeah, I will chat to Meg and just see what's going on with her. And then the only one we're going to be able to squeeze in is, now you will know this anyway because of the amount of scans that we do, but Laura's just been diagnosed with a DVT.
Right.
Can she ride? She's on a PICC span.
Right.
Difficult, isn't it? I mean, she might not be on the apixaban. She's not necessarily going to be on the apixaban for life. So for you guys watching, apixaban is a blood thinner that we give when somebody's had a clot in their leg or a clot in their lung or a stroke. But it's unlikely to be, well, it's not for a stroke for her. It's for a clot in her leg. And I think I shared the thing on the page about the famous rider that's had did you see the girl that had the massive DVT that actually ended up cutting off the arterial supply to her leg?
Yeah.
So she'll be on the apixaban, which is a major thing. But I guess from our point of view, we want to know why you've got it in the first place, number one.
Yeah.
And then the other thing is if it's just a primary DVT and, it's your first one, you're not going to be on a blood thinner forever for the rest of your life. So it may be that actually you maybe have a little break from riding. The risk is that obviously if you fall off, you're more likely to bleed, aren't you? So, hitting your head and stuff like that. So the reason we kind of know so much about it is so many elderly people are on a Pixaban or warfarin or all the such like, and every single time they even kind of like bump their head like that hard, we have to scan their head, don't we? So so I think with her, we just have to think, like, you know, if you are on a blood thinner, and that even goes for things like aspirin and clopidogrel and things like that, you know, you have to bear in mind, if there's anything that you take that makes you bruise more easily, that you can see on the outside, I guess I would say that you can bruise more easily on the inside. Would you say that's kind of fair?
Yeah, absolutely. Yeah. And if it's not a long-term thing, then it probably is just worth giving your body a bit of a break. Like, give yourself 6 weeks or 8 weeks, however long you're on it for.
Yeah.
And just, is it worth the risk?
Yeah, it's just weighing it up, isn't it? It's weighing it up. Right, you've got, see, look, you're getting loads of these comments here, Ginny. Hold on, let me go back. Oh, my horse has just woke. Yeah. Hello. I didn't see you there. Princess Vampirou. She's gorgeous, isn't she? I definitely recommend a no crap strap for when you get back on. It really helped me.
What's that?
It's like you can put a stirrup leather around, but you can get the oh shit straps, can't you? And they actually say oh shit, and it's like a neck strap that you just put on, so you've got something to grab if you need to. And Kate's very good because she wears her air jacket all the time. Hannah says, yeah, we love you for that. Hannah says she had a fall last year after a lorry got too close to my horse. I ended up being run over by the lorry.
Oh my God.
And ended up having 2 operations to remove dead necrotic skin down to the muscle. Ouch. Had my positive head on all the way through, and I'm back riding my new horse now. You're a legend. So there's inspiration for you right there, isn't it? I mean, what a dude.
Yeah.
Hannah says this is so interesting. Thank you so much. Oh, Vic said, could an inner ear problem causing vertigo be misinterpreted as anxiety on a horse?
I wouldn't know about the horse, I'm afraid, there.
I think if it depends whether it's like vertigo or whether it's like motion sickness, isn't it? So if it was vertigo, then it's more like it's to do with the position that your head's in. So if it was, I think it would be very unlikely, if it was motion sickness, I would say it's very, very unlikely because you've got your gunk around your semicircular canals, haven't you? Yeah, so I would think it would be unlikely. However, vertigo could, because vertigo, just by you moving, your eyes and your ears are mismatched, so you can't work out where you are in kind of time and space, so you kind of spin around. So I think vertigo, yes. Motion sickness, no, because you can see the horizon and you're looking and following the motion that the horse is doing. It's like if you go downstairs in a ship, you can feel really sick, but if you stand up on the deck, you don't feel sick because you can see the horizon. Your brain can kind of work out where you are. So so that's we've got a few more questions, but I'm going to leave them because I lost so much time in my technical problems. But thank you so much, and I'm so glad that you're okay. I've got to be honest, because I was a bit worried when I heard about it.
Yeah, fair play to. I'm sorry, I can't remember the name of the lady that said she had her positive head on, because mine has definitely failed on quite a few occasions.
Yeah, but I think it's always going to, isn't it? You're never going to just be able to be, unless she's a legend if she kept all the way through. I definitely had some very dark days, I've got to be honest. Like, I'm never going to be able to do this. Hello. My horses are wasted on me. Please don't suddenly bite my ear off or something. No. And it's just really, really tough, isn't it? What do you think? Have you got anything to say, Bamba? It's just really tough, isn't it? But I'm massively proud of you, because it's a massive injury that you've had, and to be back at work and just positive, and it's massily like clap yourself on the back, but not hard, because obviously you've got
not too hard.
You've got fractures. Vic says, do we both regularly swap our stirrup leathers around?
No. I don't think I've swapped my stirrup leathers around since he got a new saddle.
Because Maeve, leave me alone, the lovely physio that does activate your seat, which I do have, which may well help you quite a lot once you actually get unbroken. But if you're getting on all the time from one side, it stretches your stirrup leather. So you end up with like a leg length difference, I guess. And interestingly, yesterday at Talent, Pammy asked me whether I measure my stirrup leathers. And I was like, no. And she was like, well, she always makes a point of measuring her stirrup leathers every week to make sure that they are, Vic says she's telling Maeve, don't tell her, she'll kill us. We should know better being in the Equiboodle tribe. We should know this insider knowledge that we get from these wonderful people that we've all met. But yeah, I don't do that. But I think for you, definitely, you probably need to, because that would be the issue, wouldn't it? I suppose, having a slight difference in leg length, you're going to have to get those muscles sorted, aren't you?
Yeah.
So you've got a few more comments. Let me just have a look before we go. So Kate says she recently bought some Brave pants. What colour, Kate? Much helps my positivity to be able to laugh in the face of adversity or flash your Brave pants to your horse. Really essential. I don't think I have any Brave pants. I need them for old donkey here. But have you got any? I don't think I have any.
I don't think I have, actually. No.
Maybe I should buy you some for when you get back on. I'll get you some Marks and Spencer cotton ones and just like fabric paint it on. You could get the up to the boob one. You can wear over the top of your breeches. It'd be hilarious.
Amazing.
We definitely need pictures. That's content, Ginny, without a doubt. So Sarah said she didn't know about the stirrup leathers. Thank you. That's from Vic. You see, Sarah. That's from Vic from Maeve.
What a woman.
Emma says, great live, thank you. When is the next? It'll be in a month. And Kate's cat. Wow, impressive. Kate says that they're black with rose gold writing.
Oh, do you reckon Equiboodle would make some?
I was just thinking, I know I've seen a few comments from Vic Bodie. Equiboodle should be making a pair of Brave pants. I'm trying to persuade her to make saddle pads.
Yeah.
And
good.
Also
that'd be nice.
A little dog t-shirt.
Oh, yeah.
Can you imagine?
Oh,
so cute. So yeah, so thanks Emil. We will keep up with your progress if that's okay, and keep getting you on and off just to see how you're getting on. But obviously for you guys, this will be available on the page. So Gin, where will we find you? Because I know you've got, do you do the woodcraft? Or is it Tom?
Yeah, no, it's me. So he provides the wood for me to burn.
Tell us about this, because I saw the one that you sent to Vic and it's gorgeous.
Oh, yeah. So part of lockdown means you can't do anything really, can you, unless it's at home. And I like to do pyrography, it's called, which is essentially just burning wood, but like artistically, not just chucking it on the fire. So I've done a few, and I've just started an Instagram page. I've done a few as gifts for people mostly, and I thought, you know what, I'm getting a bit better at this now. I've had loads of time to practice.
Yeah, no, it's gorgeous, absolutely gorgeous. So where would people find that on Instagram? What's the name of the page?
It's Woodland Country Crafts, and there's an underscore between each one. And it's an open page. You can sort of go and have a look and see if it's your sort of thing, then give us a follow. If it's not, then that's fine. So
I'll pop that on. And do you want people to follow you on Instagram?
Yeah, that'd be lovely. Yeah.
Page. But I think like people will be really like wanting to see how you're getting on and stuff, because it's pretty impressive, isn't she? Yeah.
Yeah, that's fine. Give us a follow. Like, I've followed from the Equiboodle tribe quite a few people, and it's great because it's meant that the adverts have reduced on my Instagram, and loads of people that are doing things that I'm interested in have popped up instead.
Oh, that's perfect. Right, so guys, we're going to shoot now, so that I'm actually going to go and get in the spa, if I'm honest.
Jealous.
I know. She says being in Devon, having been in the sea. I don't think
I'm not
you've
getting back
won
in
it.
there.
Yeah. Oh, Jane says great Highland cow on your Instagram. So she must have looked.
Thank you.
I know, it's awesome. And I will catch up with you very soon. So thanks a million.
Lovely. Thank you. It's nice to see you.
And you. Take care, guys.
Bye.
Bye.